The children emaciated by malnutrition have been brought by their parents for treatment at Iriri Health Center 3. Among them are those with severe cases like this little one whose body cracks into wounds. A good number of them have excessively lost weight, while others are having swollen bodies.
This is a result of minimal or too little protein in the body. You see, the protein in the body is used to build up cells. And these cells, the skin is part of the cells. So when the body lacks protein, there is what they say deficiency. And when it is a deficiency, it means this regeneration of cells may not happen. So even the few cells you have, they start breaking, the skin starts breaking, and building up those skins, that skin becomes difficult.
Both Napak Health Center 2 and Iriri Health Center 3 are credited with handling malnourished children below the age of 5. However, they have been forced by the situation to handle those above the age. While the cases for Napak are in the double digits, Iriri long surpassed it.
It was in June where we saw the numbers were really increasing. Because in the first appointment, we had around 14 cases we had admitted. But when it reached the second appointment, it increased actually to 35 cases. Then yesterday it increased again to around 65 cases. We even returned again some.
But this year, this is 248 in this shortest time. And these are communities from within. And we have other health centers also covered in the same sub-county, which also enrolled some other children from there. So when you sum up this number, it is quite high.
The treatment is complicated by the situation in which the breastfeeding mothers are also malnourished and the lack of food, which means the medicine is taken on empty stomach.
Actually, when they come, we give them appointment. When they come back, you see the situation is worsening. But a few only improve. You see the situation is worsening. Those ones we just refer. Sometimes when you refer them, and near is far. From here to Iriri Health Center, it's around 25 kilometers, which is far. Some of them, even if you refer, they can still go and stay at home. They cannot go there.
And you see what has escalated this is also the insecurity. People are now living, they are becoming more internally displaced from their own homes. Some people have come to the centers here in Iriri, and you cannot depend on somebody's family. It would have been better if you are in your family and then you solicit ways of surviving independently.
The effect is the failed response to medication.
Medically, it is not good to be malnourished because it affects the brain. Both the brain and the physical build-up. So somebody who undergoes malnutrition in the future may not be intelligent. That is the impact of this malnutrition. The upstairs may not be all that good. But of course, with the physical, they may grow, but may not grow to the extent where he or she was supposed to be.
Yesterday, we showed the story of the families feeding on wild leaves, premature raw sorghum, and others had gone without a meal for days, exacerbating the health situation.
This queue here is shorter. Minutes ago, it was longer than this. It is of children who are malnourished, just not being malnourished, but severe malnutrition. The effect is the cost of treatment to government and the pressure to the health personnel, and the sooner it is addressed, the better for the country. Jackson Onyango, reporting for NTV.